Hi, my name is Kelly, and tomorrow I will be undergoing a procedure, a surgery, called Anterior Cervical Discectomy. What this is basically a realignment of your neck vertebrae and an actual fusion by removing the worn or damaged discs and replacing them with a piece of bone, which will later on fuse the discs together. In addition, the scope of this surgery will the doctor will break off any bone spurs that you have, which I do have some of that, and he will actually clean out your foraminal openings if you have foraminal stenosis, which is what I have. And the foraminal openings are the places where the nerves come out of the spinal column. Many people will have this procedure because they have spinal stenosis, which I really don't have any of. What I do have is 4 bulging discs, osteoarthritis of all of the joints, and also I have the bone spurs that are growing from my vertebrae as a result of my neck trying to protect itself. I have a pinched nerve, which affects my right arm, and I've been dealing with this right arm pinched nerve pain for about 6 months. I've been living in chronic pain pretty much for about 10 years. Daily headaches and neck pain, and so it took me a long time to arrive at this conclusion that I was going to need to have this surgery. I tried many alternative therapies, but none of them really worked, and finally I've kind of come to this conclusion after my last MRI that the degenerative changes that have happened are just not going to repair themselves. They're going to need to be repaired. So I'm very hopeful that this surgery is going to make a big life change for me. The reason why I'm making this video is because when I was trying to discover what would be the right option for me, I went to Google and I Googled neck surgery, and I saw a bunch of videos on YouTube that were very helpful to me, that people lovingly went out there and made to help others who were trying to consider this surgery. So I wanted to help, and this is why I'm making this little video. Let's see. Preparation for surgery: no eating or drinking after midnight tonight. Take off all your nail polish. The way that I found my doctor was from a referral from a friend, and luckily I have a doctor right here in my town who is one of the top 50 spine surgeons in the country. He gave me 2 options for bone replacement during the surgery. One of the options is that you can have some bone harvested from your hip. So you have 2 surgeries on one day, and quite frankly, I think that the hip healing is more difficult than the whole neck healing. The other option is that you can use bone from a cadaver. And this donor bone is clean and safe, kind of much like a blood transfusion, and it's been tested and it's perfectly safe to use. It's funny because my friend John and I were talking about this, and he said, "Kelly, take the cadaver. It's 2012. He said if it was 1812, no cadaver. But it's 2012, take the cadaver." So I've decided to use a donor bone. One, because I'm actually an organ donor, and I think that I would appreciate it if someone could use my organs or my body parts to make their life better. And so I'm going to accept the gift of the donor to make my life better. I just think it'll be kind of cool. So with all that being said, I think let me tell you just a little bit about the surgery. What they'll do is they make an incision right here along your bottom of your neckline, and they insert a tube into your trachea. They move the trachea and the esophagus out of the way, and then they have a clear view of the anterior or front of your spinal column. And this enables them to do the work that they need to do. And then they replace the discs. They attach a titanium plate, and they bolt this plate on every cervical vertebrae that's involved. In my case, I will have 3 vertebrae fused together, so I will have 4 sets of screws in my titanium plate. The reduction of movement per vertebra fused is 7%. Now, that seems like a lot, so it looks to me like I'm probably going to have about a 25% reduction in movement in the joints of my neck. I already have quite a bit of reduction of movement, so I don't think this is going to change very much for me. I can only do certain things. I can go pretty far this way. I can go to here this way. It's very painful to go back, and I basically cannot do this hardly at all. This is just completely not very good. So I think that 25% reduction I'm going to be able to live with. Anyway, I'm excited about this whole thing. I'm trying to be very positive. There's a lot of people out there who are praying for me and thinking about me, and I really appreciate that. So I am looking forward to the post operation video that I will provide so that you can see, how things go. Thanks for listening, and look for the post-op.